Hello, good evening. My name is Melissa, and I'm here to interview Mr. Jerry Yuto, an occupational therapist at Westminster. Mr. Jerry, can you please tell us something about yourself?
Yes, my name is Jerry. I've been an occupational therapist for about 21 years. I truly enjoyed it. Currently working at Westminster Services here in Jacksonville, Florida, in a retirement center. Um, we cater to an in-house 60-bed Medicare patients. We also cater to outpatient rehabilitation, and I'm enjoying it.
Why did you choose this career?
Well, I really wanted this. I started with having interest in special children. That's what prompted me to start looking into occupational therapy. And then after learning which profession would best help the special children, I learned that one profession, healthcare profession that would cater to that is occupational therapy. That's how I started, and when I got over here in the United States back in 1992, the demand of the job is in the physical adult physical dysfunction, and pretty much occupational therapy. The neat thing about it is that you have a wide range of patients or clients from pediatrics all the way to geriatrics. So that's how I got started.
When you were still in school and studying to become an occupational therapist, is there anything that you think I need to be prepared for if I do pursue an occupational therapy?
Things that you need to be prepared for, well, you need to be focused. It's a very demanding, when I remember being a student, the schedule was very demanding. The time allotted for studies, we started in 90. There were about 90 of us who started in the occupational therapy program, and on our 5th year, there were only 23 of us who graduated. So there were a lot of focus involved. There's a lot of pressures involved. I think you need to be prepared for, yes, the demand to be, to do well in the profession.
So the hours that you actually need to give to this career would be
yes,
almost most of your time.
Yes, and then also not only that, at school you spend a lot of time studying the theoreticals, your basic sciences, anatomy, physiology, and all that stuff. But going to your clinical internship, that's when you implement what you've learned from school and incorporate it to the real world. It's an exciting time, but it's also a scary time. So you need to be prepared for transitioning. The OT program transitions from point A to point B to point C. You have to be prepared for those transitions. Don't be scared, it's just part of it.
And so with your experience as an occupational therapist, how would you describe your career right now?
I think occupational therapy is a very rewarding career. I am very thankful and blessed that I am in this profession. It's about, number one, it's about being an agent of change. You're part of contributing to someone's life, changing it to be better. And being part of that, knowing that you're part of a healthcare profession that's giving you the ability, the skills to help someone else, is the most rewarding. And also I think in these tough times of economy, it's also a blessing to be an OT, because financially it's a rewarding career. Yes, so you'll do well. Okay.
So if I just may ask, what is the role of communication in this career?
Communication in just about anything else is very vital. Let me just cite an example. Working in my facility day to day, the day-to-day operation, we started with stand-up meetings where You will be with your healthcare administrator, the social service, the other therapy services, your executive director, even housekeeping, dining services and all that. You discuss about safety, anybody who had a fall, any family concerns pertaining to their loved ones is being brought up to the table. Communication is very vital. You are being asked for your feedback, consults, referrals. We have care plan meetings, we have interdisciplinary meetings, we have CQIs, quality assurance. You have meetings with your medical director, looking at your program, therapy program. You are on a constant level of communication every day to make sure that the operation is smooth. Number one, you're addressing the concerns of the patients, that's keeping the patient safe, functional, independent, and it's no longer like, you know, someone comes to you and you treat that patient for occupational. It's not that anymore. Occupational therapy is more than that. You do a lot of family education. You even have to come to their homes to do some environmental changes prior to the discharge. So from point one, from the point of assessment all the way to point of discharge, there are so many complexities in the communications to every discipline, from patient to family members, to other therapy disciplines, to social service, to, you know, everybody. And you communicate those, and they communicate things to you on a day-to-day basis. I think communication is critical in this profession. You gotta be a dynamic team player to become effective, and also it's a good thing. It's a good thing to be an integral team player with, you know, when you work in a certain environment like in my center, retirement center. It's just critical, you know, to the success of the program.
That's very, really very interesting to know that from the start of assessing the patient and everything, and then just I think, I know I've heard about it, but I just realized today that you actually need to look at the place where they are going to be discharged to make sure that their safety and everything is.
You know, when I was in school, I didn't know that how important it is not to be confined in a clinic and you do your therapeutic exercises, activities. You go out that boundaries as an OT. You are not confined to those boundaries. It's just unlimited. You go out there, you go to the community. Sometimes you even go to their workplace, do an assessment and make sure that they'll be able to return and they're accommodated with whatever physical disabilities they have or impairment. You design their environment to be functional again and be part of the society again, being productive, functional, and safe, whether it be at home or workplace, or even just, you know, being, if their home happened to be in a retirement center, you want to make sure that everything works well. You know, it's an interesting part of the healthcare profession.
So, in relation to what you were saying, that you can go to the community and everything, could you give me some information about the growth potential in this career?
Oh, have mercy. Growth. Well, for one thing, being a rehab manager, in my current workplace, I'm the rehab director there for almost 9 years now. The growth potential, well, let me just put it this way. I'm being asked almost and including my OT clinicians, we are being asked and having a barrage of phone calls, see if I would be interested in working in other facilities, or if I could help them out. And that's just me. There are literally hundreds of therapists, OTs I know, OTs and CODAs, who are very, very much in demand, and they need OTs, OT clinicians out there in the field.
And
there's a big, I think there's a big shortage based on the trending that I'm seeing now. OTs are badly needed.
So they're actually looking for occupational therapists, and I know
Almost
that
every day.
you can actually have your own how would you call this, be on your own, is to actually be an independent
Sort of like a private practice?
yeah, something like that.
Oh yeah, pretty much. You have a leverage uh, as a clinician, as an OT, to do pretty much whatever you want. That's the neat thing. You can again, you can do pediatrics, you can do industrial rehab, you can opt to teach in a university or colleges, or you can do geriatrics. You can do consultant for you know. Proper body mechanics, you know, a lecturer. I mean, you can do it. The possibilities are endless.
Okay, that actually answered my next question. So,
Okay.
the last question I have is, as a person and as a professional, how are you going to describe your experience as an occupational therapist?
Oh, it's a blast. My experience, it's very rewarding. Being an OT is very rewarding. Again, I've been doing it for 21 years. It's a very rewarding career. It's very humbling to be part of, again, being able to change someone's life to be better. It's an amazing career. I'm thankful, and if I were to do things all over again, I would be an OT again.
I really appreciate the time that you have provided me, Mr. Jerry.
You're welcome. You're
It
welcome.
really enlightened me a lot about occupational therapy and the things that I can do if I do pursue this career, and I really appreciate it.
Well, I would encourage you. I would encourage you to pursue the career. I don't think you would not be sorry of pursuing this profession, and it's you're needed. You know, there are a bunch of you that are needed, and I appreciate you asking me. It's an honor.
Thank you.
You're welcome.
Thank you.
All right.